Outcome of selective root canal retreatment, a retrospective cohort study by ACTA group. This study was published in 2023 in March. Selective root canal retreatment has been employed and used clinically for many years. However, scientifically, it has not been reported until 2015 as a novel approach by Nodera in a case series. So the aim of this study was to evaluate the outcome retrospectively of this approach with at least 1 year follow-up. And also they want to assess the periapical status of untreated roots that was diagnosed with no apical periodontitis as initial diagnosis. And also they want to assess the tooth survival. The data for this retrospective study were collected from 3 private clinics in Amsterdam from 2018 to 2021. And the inclusion criteria, obviously they will include multi-rooted teeth, and the tooth must be diagnosed with symptomatic apical periodontitis and a previously endodontically treated tooth. Also the follow-up period must extend at least up to 1 year. So they ended up having 75 tooth with 195 roots. For radiographic assessment, they used Patel criteria 2012, and as you can see it in table 1, so from 1 to 3 it's either a new disease or a persistent one, and from 4 to 6 it's either a healing or a healed tooth. For tooth survival, it was defined as the presence of the tooth regardless of the clinical or radiographical findings. For outcome assessments, either the tooth will be classified as favorable when there is a score from 4 to 6 based on the criteria we have mentioned, and there is no clinical sign and symptoms, or as unfavorable when the score in the radiograph from 1 to 3, or there is a clinical sign and symptoms. For the results, the most frequently retreated tooth was the maxillary first molar, especially the mesiobuccal root, due to the missing MB2, which was found in 70 to 5% of the cases as a missing canal. The favorable outcome per tooth was 86.7, and the tooth survival rate was 91.5 at 12 to 48 months. The probability of developing a new periapical pathosis in untreated root was 3.5%. For the limitation of this study, given the fact that it is a retrospective study, cohort retrospective study, there is no conventional group to compare it to the new approach. However, one advantage also, it has been performed in different clinical setups. It was not randomized and it was not controlled, so it shows its effectiveness disregard of the operator.